Hello everyone, my name is Nazmi Calik from PCR Online, and today we are having the distinct pleasure of having Dr. John Alexander from Duke University, United States, to discuss the results of the Pacific AMI trial. Dr. Alexander, thank you so much for accepting our kind invitation.
My pleasure.
My first question is, what are the main takeaways of the Pacific AMI trials? Could you please provide us with the design and the results of the trial?
Yes, I'd be happy to. So Pacific AMI is a phase 2 trial, so that's very important. Its objective was to explore a number of doses of the factor 11 inhibitor asundexian versus placebo in patients with a recent acute myocardial infarction on a background of dual antiplatelet therapy. So asundexian is a factor 11 inhibitor, and there is the hypothesis that it may be a effective anticoagulant at preventing thrombotic events without causing bleeding, while still allowing hemostasis. So it inhibits upstream in the coagulation cascade, inhibiting factor 11, which plays a key role in the burst of thrombin activity, but it still allows some generation of thrombin that is necessary for hemostasis. So we studied 3 doses, 10, 20, and 50 milligrams of asundexian versus placebo for a year in patients following an acute myocardial infarction. Our outcomes were measuring factor 11 inhibition to know how much we were inhibiting, and then bleeding and ischemic events. So first, regarding the factor 11 inhibition, with 10 milligrams we saw about 70% inhibition, 20 milligrams about 80%, and with 50 milligrams more than 90% inhibition of factor 11. So almost complete inhibition of factor 11. Yes. We saw no increase in bleeding. I mean,
this is the main point of the trial.
That's right. So we completely inhibited factor 11 and we saw no increase in bleeding. This still needs to be replicated in phase 3, but it's very promising. Yeah.
Is there any ongoing phase 3 trial or any planned phase 3 trial?
So asundexian is being developed by Bayer, and it's a big, they're planning a large phase 3 program. They're planning a atrial fibrillation trial, a stroke trial, and we're having discussions about an acute MI trial, but there's no plan to start one right now. Okay,
no plan.
So I mean that's really the main findings from Pacific AMI.
Thank you so much. And what do you think? My last question is, what do you think about the feature of the factor 11 inhibition? Also in atrial fibrillation patients and also in the post-myocardial infarction patients.
Yeah. So what we use in really across cardiovascular care is antiplatelet drugs and anticoagulants, and they all are limited by bleeding.
Yeah.
Right? I mean, they're all limited by bleeding. So
we need to pay a price.
Yes. So the real goal here is to develop an antithrombotic drug that doesn't cause either any bleeding or as much bleeding as our current options. And then you can start to imagine all the places where that might be beneficial. So in atrial fibrillation, I mean, imagine if we had drugs that were as effective as factor 10 inhibitors but didn't cause bleeding. I mean, that would be a huge advance. In stroke, there's a huge need for antithrombotic therapies that don't cause bleeding. And post-MI, there's also a need for antithrombotic therapies that don't cause bleeding. We're trying right now to shorten duration of P2Y12 inhibitors because of bleeding, right? Yeah. We don't use oral anticoagulants like rivaroxaban and VKA, vitamin K antagonists that we know are effective because they cause too much bleeding.
Bleeding, yes.
Right? So what factor 11 inhibitors I think will cause less bleeding. The key unknown is, do they work?
Yes. They will be efficient or not.
That's right.
This is the main question.
That's right. Answered in phase 3.
Yes, yes. Thank you so much, Dr. Alexander, for accepting our invitation again. And please stay tuned with the PCR Online, and please keep following us on social media and from our website. Thank you so much.